you for joining us this evening for kind of an impromptu meeting. It's not Nevada Now's meeting, it's we're hosting it tonight. We have some wonderful speakers and an important topic that we thought we needed an emergency meeting. So I'm Jerry Burton. I'm the president of Nevada Now. So NOW has been around for 50 years, and this is a core issue, one of our 6 core issues. So, of course, it's really important to talk about reproductive rights and justice. And first, I'm going to quickly introduce our board and a couple of our guest people. So I don't think Trisha's on. Trisha Methner is our vice president. If she's here, I don't know. You've met Eva. She's our vice president outreach. Madalena Roberson is our Vice President Media and helping me put links in the chat, so there's some information about NOW in there. We have Sue Birch. She is, I have to get the long list, Sue, Vice President Legislative Action and Nevada Now PAC Treasurer. She's also in charge of our committee for when we are working on legislative bills. Lenore Briley, I think she's not on yet, but getting on soon. She's our longtime treasurer. And our secretary, Michelle Maese, and I see Michelle. And we also are joined, I'm continuing to introduce 2 of my favorite people, Maya Strope and Morgan Renfro. They've started the Lao Girls Club in their school. They're juniors at the West Career and Technical Academy in Las Vegas. And they've invited some of their members, and we're so glad you could join us. And then So before I get started, we're going to get right into the program, but I have a special person, a special situation with Samantha Glover, our friend with Red Equity. And Samantha is going to talk to you really quickly about an emergency thing she has for donations. So Samantha.
Hi, I'm Samantha. If you don't know me, I'm the co-founder and policy director at Red Equity. We're a national nonprofit focused on ending period poverty and promoting menstrual equity. So we have 5 branches, one in Nevada, Colorado, California, Oklahoma, and the District of Columbia. And we work on ending period poverty because since the beginning of the pandemic, 1 in 3 women have struggled to afford menstrual products. There are no federal benefit programs that cover menstrual products, and 1 in 4 high school students have missed class because they can't afford menstrual products. And when it comes to the little emergencies Jerry was talking about, we recently had a really large national event that was basically organized by one of our biggest donors. However, that donor recently is very, very ill and nearly passed away. So she's no longer able to fund the event. And so now we have an emergency fundraising goal of around $5,000 in the next week. So we ask everyone, our action item is not only for you to donate, but share this donation link with everyone and anyone you know, because we're fully volunteer run and youth powered. So the majority of the work is just me. And I'm only 16, and Abby, the McAdams, the other co-founder who's in college. So we don't really have any savings to tap into because otherwise we would to cover this cost. So we ask really nicely for you all to donate anything you can spare. And please, please, please share this link with anyone you know, your neighbors, siblings, friends. But thank you all for coming. And thanks, Jerry, for letting me hop on and share about this really big emergency for us.
Well, Samantha called me and I said, we're having a program tonight, hop on. Nevada Now has already said we'll donate $200, Samantha, so we'll be putting that right away. And we'll be making phone calls with you tomorrow to help raise money. But I thought it was a good chance to hit people up while while a bunch of like-minded people are together. So thank you. If anybody has any other questions, they can contact me or Samantha. So back to our program, our scheduled program. So our reproductive rights are under attack in the United States, and we're hearing from our members asking what's going to happen in Nevada if Roe v. Wade were overturned, and how can we help other people in other states. And, you know, we've worked hard in Nevada to have safe, legal abortions, reproductive health care for all Nevadans. And we know this impacts people of color in particular, and trans and non-binary people are often overlooked in this conversation. So we've invited Sai, was added to our program today, to talk to us about that. So with Texas, the SB 8 becoming law, effectively banning abortions after 6 weeks and allowing private citizens to sue anyone perceived to be helping patients obtain abortions without exception for cases involving rape or incest, and the Supreme Court ruling 5-4, denying the request from the Texas abortion providers to block the law. We need to understand where Nevada's laws stand and what is needed to protect us, and find ways to help people in Texas. And we know that other states will be right in line to have this happen next. So we've invited some amazing people who will be the experts on this. I heard this morning, Rebecca Tong, she's with the Trusted Women Foundation in Oklahoma. And she has people calling to send people from Texas into Oklahoma. And she said for the state of Texas to be telling their citizens to go out of state during a pandemic for a pill and for a 5-minute procedure is just cruel. And I backed it up and I had to write that down because that just kind of puts it in a nutshell. The United Nations has now said that the human rights monitors have strongly condemned the state of Texas for its anti-abortion law, which they say violates international law by denying women control over their own bodies and endangering their lives. And I think Justice Sotomayor said it best. She said, the court's order is stunning. Presented with an application to enjoin a flagrantly unconstitutional law engineered to prohibit women from exercising their constitutional rights and evade judicial scrutiny, a majority of the justices have opted to bury their heads in the sand. So we've invited this great panel of people that I admire and look forward to hearing from. And we're going to start off first where we're lucky to have Austin Now's president, Alexia, I'm going to say it wrong. Okay, say it for me, Alexia, her last name. Emuze?
I really forgot. She said I have to unmute myself.
Oh, that's okay.
It's Alexia Emuze.
Emuze. Thank you so much for taking time. We know how busy you are with everybody asking to have you attend NOW meetings in particular. And we wanted to hear from you, get an update and what actions you're taking that we can help with. So thanks for joining us.
Thank you. I'm really happy to be here. I feel like what's happening here in Austin, in Texas, is really, as you said, the blueprint of what can happen in other southern states and that they're actually gunning towards. I know it's funny using that since now Texas also allowed people to have open carry permits as well. That was also launched the same day. But anyway, I know Mississippi, Florida, and Georgia are places that laws like this can really affect their BIPOC population. Here in Texas, we have a few things going on. I know the Women's March is happening in October, I believe, October 2nd. We were going to wait until then. However, we felt that this was something that really needed to be addressed in the month of September, just to kind of keep that flame going until October. Sorry, I've been so running on E, dealing with all of this. Some action items that we have. September 18th from 11 to 1 p.m., we'll be doing a peaceful protest at the state capitol here in Austin. We're really trying to put more light onto that and gather more people to come and help support in solidarity, share stop Texas SB 8 now, hashtag online as well, just to really generate more media here. If you can, protest at the same time in your own city, in your own state, just to bring more attention to this. A lot of people are starting now to understand just how serious SB 8 is, especially since random people you don't even know can try to sue you. And I was reading also that if you do win the lawsuit, if the woman or the person wins the lawsuit, they're not able to get any refunds for anything that they've spent on actually trying to stop that action against them, which would put them into more debt. And a lot of it seems to be targeted, as you mentioned earlier, towards BIPOC and women of color. And I think that that's something that we need to really push out there more, because if this is supposed to be something to protect all life, why are there not bills or actions put forth after making women have to keep these children? Nothing has been put into law saying that welfare is going to change, or WIC, or they're going to have more education against like how to stop, how to have safe sex, or how to protect yourself. Like no bills like that have been mentioned yet. So I feel like bringing more attention to that is really important, because a lot of pro-life, they just talk about before and trying to basically control women before all that happens, and then leave it up to us to just basically figure it out. So we're trying to bring a lot of attention onto that and really keep the movement going and understanding why this is so important. One thing that we do have is we just started a fundraiser. I'm not sure if all of you know, but Austin did not really have NOW for the past, I think, 5 to 8 years. So we're fairly new back in Austin. So we're still figuring out how to do funding, and it's completely, of course, all, as you know, a nonprofit. So it's a lot of time, and we're trying to basically get rid of the need for membership, for members to have to pay a fee, so we can start getting more members and getting people involved in NOW, and really get the youth here in Austin to focus on these issues, because most of us don't even realize what's going on until after something's being passed, or when it's too late for us to basically take a stance against that. So that's really what our main focus on right now, is just more youth involvement in Austin and spreading the awareness of our organization, and that we can help you. We can help you figure out what to do if you're past that 6 weeks, help you get involved with organizations that can help you get out of Texas to go and seek reproductive health care. So that's basically what our action is right now. Sorry, I know that was probably really long. I just needed to get that out.
That's wonderful. That's what we needed to hear. And we have someone with us that is going to speak in a little bit. Carla has a fund that, she's helping people with an abortion fund. It's the only one in Nevada. So we'll hear from Carla, but keep us posted on how we can help in those areas. Just as a little bit of snark, I heard that the governor is going to eliminate rape. So the governor of Texas says he don't worry about the rape part of this, that he's going to eliminate it. So I thought that was eye-opening how, just ridiculous it is. So, but thank you so much. And again, if you could send me the flyer that you had, you said it's kind of hard to put that kind of stuff in a chat. We'll put that out to people and let them know about. And what date was the event you had? I saw someone had asked that.
It is September 8th. September 18th from 11 a.m. to 1 p.m. Okay. We also have all the information on our website. I listed it in the chat.
Oh, good. Okay.
And I also put our fundraiser in there as well. I can go ahead and re-add that. Texas is, yes, that's something that I also noticed too. There hasn't been any change in the expensiveness of rape kits, legal action against being assaulted, or even the fact that Governor Abbott, I think he took like antibiotics that were created from fetal tissue, which is so funny that that's exactly what he decided he wanted to outlaw. And he said that people should get the same kind of antibiotic test that he got, which he just outlawed. So, my 2 cents.
That's crazy. So, before we get to the Nevada portion of our speakers, does anybody else have any questions of Alexia that you want to ask, or put something in the chat that we can ask her? All right, great. Well, thank you so much, and please stay on as long as you can. I know you've got other events to go to this evening, and you've got a 2-hour time difference. So I know you're preparing for another event, but I appreciate you taking time, and again, send us whatever we can do to help. And I know a lot of people on the national board of NOW, and we definitely need to work on getting that taken care of for you, so that you get younger people that there's got to be some funding we can do or eliminate the fees for young people in Texas, because we need more to help you. So you and I can talk about that on a side. Yeah, I know a lot of board members. I used to be on the board. So. Thank you so much.
Thank you.
Thanks. So again, we're fortunate to have some wonderful activists and friends to Nevada now who work every day on abortion rights and reproductive health care. We worked with several of you to pass the Trust the Nevada Women Act. And we look forward to hearing, what more people can do to help. We've been getting a lot of phone calls. I know you have been. So the first thing I did was contact the next two speakers because that's who I go to, and I hear about these kind of things. Lindsey Harmon with Planned Parenthood Votes Nevada will go first, and then Carolyn Mello. Do I say the whole name, Carolyn? Carolyn Mello Roberson. She's the Southwest Regional Director of NARAL Pro-Choice America, and both are good friends to Nevada now. So, Lindsey, if you want to go first.
Yeah, sure. So thank you for having me. I'm going to kind of talk about patient impact today because I think a lot of what we've been hearing about is laws and policies, and really we need to stay focused on the folks that this is really impacting, which are the patients. And some of those are Planned Parenthood patients. So two things really are happening right now. We're awakening our supporters and allies to the reality of this threat that we've been talking about for some time now, actually since Trump came into office, about the likelihood of SCOTUS kind of overturning Roe v. Wade. And then the second is this kind of state level emboldenment of the opposition to pursue copycat legislation in other states. So I think it's really critically important that we're all here today because as Nevadans, we have to stay vigilant, even in a state that has the right to access abortion statutorily protected since the 90s, which Jerry's talked about. And I want to illuminate some things for folks too. So 6 weeks is before most people know they're pregnant. You usually have a positive pregnancy test at 4 or 5 weeks. This means that you can get that you maybe get in to see a provider the following week. So you have a week to decide what your options are, or find a doctor or talk to your support group. And then you get a positive pregnancy test. You have to make the appointment. You have an ultrasound. And then in Texas, they have a 24-hour waiting period. So there's a tacked on day that you then have to come back. And I think on top of that, right, we know that patients have to get childcare, transportation, costs, right, to put gas to put in your car, or maybe to use public transportation. So this is essentially an outright abortion ban. So as much as you'll hear the 6-week conversation, it is essentially a full abortion ban in Texas. So prior to this law, 85% of abortions in Texas had taken place after 6 weeks. So they've been essentially cut off 85% of the patients that are now have access to abortions. And now, according to the Guttmacher Institute, Texas patients will now have to travel 20 times farther to get an abortion, increasing driving times of about 3.5 hours. So we know that this is a straight up assault on patients and folks that are seeking abortions. So this law means that only 16% of Texans seeking an abortion will be able to access the state, and as many as 46 people seeking abortions in Texas will have to carry out their pregnancies. So this is, we've actually been dealing with this for a long time. In 2020, Governor Abbott, with his executive order, banned abortion for nearly a month in Texas as part of everyone has to stay home. You're only allowed to have essential health care. And as part of that, he outright banned abortion for almost a month in Texas. And what we saw in Nevada was a 12-fold increase in patients coming into Nevada to get their abortions. Primarily Las Vegas, because it is an easy travel state here. So this is not only impacting folks in Texas, but it's impacting folks in Nevada because now there's additional patients in Nevada. It's important that you all know that Planned Parenthood's health centers are still open. We will still continue to see patients both in Texas within the parameters of that law and in Nevada. And we are Planned Parenthood is making every effort possible to find ways to connect those women and folks who are pregnant with the resources they need. Let's see what else. I'm going to put some links in the chat after this, and I want you all to see that, so that you can, donate to the health centers in Texas. You can donate to the Action Fund at the national level. You can also donate to some organizations in state that are supporting folks to get into Nevada to get their abortions. Let's see. Overwhelmingly nationally, there are 600 restrictions introduced in 2021. So this is a trend that is not going away. And that, there is also a Supreme Court hearing on a Mississippi case coming up. So this has been a strategic long-term move on the part of our opposition to undo Roe. And really it's, there is, I think when you talk to folks about SCOTUS and the makeup of the court with, the appointment of Kavanaugh and Amy Coney Barrett, I think a lot of folks were like, is this really going to happen? Or are y'all just kind of raising the alarm? I think we can all agree now, this is really happening. And this is probably one of the scariest moments for folks that have been working for abortion rights in a very long time. This is a full out assault on patients, Planned Parenthood's patients, women, communities of color. It is really the most egregious thing we have seen in a while. And I know Caroline's going to speak next, and she's going to talk about the legal aspect of that. But I think it's really important that we, as we start thinking about these issues and how we can support the effort, I think it's really important to think of those individual patients in our mind and think, man, that is quite the struggle. So I'm going to put some petitions and some action items in the chat. But Jerry, back to you.
And I'm going to take a little aside and introduce somebody that I've always wanted to meet and has joined us today. And Poppy Northcutt is the president of Texas now. And I've admired you for a long time, Poppy. If you want to pipe up with some of the things we've missed about Texas, I know you can tell us.
Yeah, I'd be happy to. I don't want to interrupt your program, though. Go ahead with your program. I can probably give you some more on the ground information after you've heard the other people.
Well, I didn't know if you could stay on, and I didn't want to. I was trying to.
How long do you expect to be on?
Probably maybe an hour. I don't know. We'll probably hour and a half.
I can handle that. I might fall asleep, but I can handle it.
I'll wake you up when we're ready for you. Thank you so much.
Yeah, talk real loud.
Well, I'm excited that you're here. Thank you. So, Carolyn, we'll have you go next and tell us about the laws and what NARAL is doing.
Thank you. And Poppy, I'm married to a Texan, so your accent is kind of music to my ears. You sound just like my mother-in-law, so it's bringing me back a little bit. So thank you, and I'm excited to hear from you. So those of you who haven't had a chance to meet yet, hi, I'm Caroline. I'm the Southwest Regional Director for NARAL. Before I talk, I want to acknowledge that we have some really superstar politicians in this Zoom that I'm sorry to embarrass y'all, but I'm just going to say it. So we have Assemblyman Steve Yeager, we have Assemblywoman Venetia Constantine, and we have Assemblywoman Danielle Monroe Moreno. I think that was all that I saw, but I want to shout that out because you all are like earning major brownie points for me, but also just that this is the life of what it is to be a part-time, part-year legislator in Nevada, that they're hustling really to get information, probably after a long day in court for some of you, and for other you hustling grandkids, and who knows, what other things are going on, but that you're here. So thank you, those of you who are here.
Carolyn, I'm sorry to interrupt while we're introducing. We also have the Georgia Now president, Triana, is here. So just wanted to point out we have other now royalty.
Now royalty everywhere. I love it. I partner with your Arizona folks all the time too, so y'all are the best. So I'm just going to talk really briefly about our Nevada laws, and I will put up this fun little Who Decides report in the chat, which is a PDF that gives some of the information about what our laws are like in Nevada, because we just heard a lot of really terrible, awful things happening in Texas. We have a very different picture in our state, and that really is thanks to many of you. So I want to say thank you to all the women. I was not of voting age in 1990, but I'm very glad that you all did do that, because it made a huge difference for us and for those of us doing this work today. So I put up a PDF so you all can like peruse at your leisure sort of what protected access looks like in our state. But just to put up top, we have a pro-choice governor who supports reproductive freedom. The first time that we've had a Democratic pro-choice governor since 1990. And as Jerry mentioned, we had the first conversation in 2019 to update our abortion laws, including removing criminal penalties for abortion, where we used to have $10,000 or a 10-year fine was on the books for women facing abortion. And we and we got those off the books. So there's no criminal penalties out there, and that's great. And a bunch of other things, like there was a requirement to ask a woman if she was married before she had an abortion, which led to a very interesting conversation. I will never forget this actually in the hearing. Senator Scott Hammond asked Ivana Cancela, who was Senator Cancela at the time, whether maybe a man should have, or a woman should be asked if she's married. I mean, seems relevant. And she just really like calmly in a very Senator Cancela kind of way just said like, well, with due respect, men are not asked before they have a vasectomy if they're married. So, and it was just like a really good kind of left it there moment like she does. I would have been all like mad, but she didn't. She just left it there. And it was really beautiful. And I think that's kind of the picture of what it is to elect folks who get it and then who will fight for it. And so thank you to all of you. I don't know if you can see on my wall, there's a big, beautiful sign of all the pictures that we did from 2019. Someday soon, we're going to be together on a feminist road trip. And I can't wait. I want to point out that we have a pro-choice majority and super majority really in the assembly, and a squeaker, but a good majority in the Senate that we're hoping to grow. And so I don't want to do too much electioning here, but reminding folks that unfortunately for our wonderful assembly folks, they're up every 2 years. And so we get to talk with them. I mean, fortunately, but y'all have a lot of campaigning to do. And so remember, 2022 is just around the corner. We have to protect these majorities. We cannot get complacent in our state. I want to just point out some of the protections that we have on the books. As some smarty in the chat mentioned, in 1990, we had a ballot referendum, which codified our a right to abortion by voters. So here's what it did. And I are want to explain this so folks are clear, because you all could help me a lot. We do not have state protections in our state constitution. And I just want that to be clear, because a lot of folks think we do, and we do not. And a quiz, anyone know what requirement is for us to do that? It requires 2 ballot referendums, right? So we only did 1, and we actually did, the legislature sent it to the people, and then the people affirmed. NRS 442.250, shout out to Mylyn Hawkins for allowing me to memorize that. And she worked on it. And if anyone knows Mylyn, she says it a lot. And so that blocked our statute, the 1973, what the legislature said about legal abortion. And voters said, yep, we like this, to the tune of 64% in 1990, which was great in that it took us out of a fight about what was happening in Texas, essentially, right? These little fights to get at more and more trying to ban abortion. And I wouldn't say that I really honestly think that cooler heads would have prevailed in Nevada, but who knows? Who knows what could have happened? But it locked that into place. But it also locked it into place. And so there's some things that we may need to amend in that, and we don't know yet how to do that because ballot referendums are not cheap. And abortion, as you all can imagine, we all talk about this here, but it's not something that voters are used to dealing with. And so I want you all to look at those protections, but think about some of the things. And if you look at NRS 442.250, you'll see a couple things that will obviously say, wow, this needs to be changed. And one of them is physician. We at, in Nevada have the opportunity to have more access to abortion. There are medical providers in many other states that can do care, but in Nevada, only doctors can. And it really restricts us. We have a medical doctor crisis on our hands. So we're not exactly sure how we want to fix this, but those kinds of things could expand access wildly. As telemedicine changes, as medication abortion changes, there's a lot of opportunity for us to do new ways to do healthcare. And I think that Nevada could be on the forefront of being different. We're one of the 9 states in the country with voter protected access to abortion. We don't know what's going to happen in June, and I don't like to predict because I'm holding out hope that the Supreme Court will see how awful this is and something will happen. And so hopefully that will. But in the meantime, we are really gathering and as Nevada to think about how we're going to prepare. And by we, I mean I want to give massive respect to the many folks who help build the Reproductive Health Rights and Justice Coalition here. So we're going to hear from the Make It Work folks later, and I can't wait to talk about the reproductive justice work we're doing. Planned Parenthood does really critical healthcare. Carla is this awesome rock star who's starting out doing abortion fund access. And then we have Jerry and Now and all y'all. And then, growing out farther, we have the folks at the ACLU, and we have to involve every other partner to make this happen. So it's really a team of all of us here together. It's not just one voice. And so that's kind of my pitch. I have if those of you are not anyone's not a NARAL member, you can sign up as a NARAL Nevada member here, and that's the best way to get our information. We are currently hiring. So if someone wants to come and work for us in Las Vegas, I would love to have an awesome activist who actually is really mission driven, and I feel all y'all are. So I'll find the job link and put that up there because I would love to hire someone to grow our team. And in the meantime, I just wanted to really acknowledge the power that's here. Say thank you so much to Jerry. I think pretty much immediately was like, what can I do about this? And that's why I almost like cried, because it made me feel so good to know that we have so much backup in this state. And so thank you so much for this opportunity to talk. And I'll pass it back to you, Jerry.
Well, and Caroline works all over the Southwest, right? So other states that you work in. So
yes, I work in Arizona, Colorado, and Nevada. So in Arizona, we're looking at pretty bad go of it. And so actually, if anyone wants to help me, starting in January, we get a fun every year session there. And those people are not playing. And last session, we had a dozen anti-choice bills, one including a death penalty for abortion providers. And we beat almost all of them. We had, unfortunately, had one restriction go through that we are litigating, and that Arizona now is, I know, one of the plaintiffs in. And so there's all these, if you're paying attention to any of the lawsuit stuff in the reproductive rights movement, it's pretty woo. But we're hopefully going to have some sanity prevail in some of these laws that are really cruel, frankly, incredibly cruel, taking folks in situations that they've, who knows what's going on, and making it worse, right? Most likely. And that's the real shame of it. So I want everybody, though, to really pop up for Carla, because I want to support the abortion fund, and particularly those in need. I feel called to do that now more than ever. So I'm going to hand it back to Jerry, but then really give money to Carla. Okay. Thanks, everybody.
Thank you. So our next speaker is somebody that I think I'm going to get to meet this weekend. I've always wanted to meet Aisha Goins. She's with Make It Work. Let's see, you're the organizing coach, I believe. And we've done some work with some of the kitchen table events they've had. And Nevada Now was involved with a few of those. So we look forward to hearing more from you on what you're working on there. And, we know that this is affecting, Black women, women of color, and how can we help in Nevada? And thank you for joining us. Can't wait to meet you in person.
It's my pleasure to be here. I appreciate the opportunity, especially given an opportunity to talk about something other than cannabis. So, I'm kind of excited. I am more than cannabis. I tell people that, right? This legislation specifically has been a travesty, right? We're all a little bit concerned. I think we all probably just woke up and was like, what in the hell? Make It Work Nevada was no different. The Black women that work here, we've been discussing it profusely amongst ourselves. It has us feeling just a little helpless, right? Because we know that this legislation is going to directly affect Black, brown, and poor women the most. Given the increased likelihood of Black women dying in childbirth, this legislation feels like it's open season on Black and brown and poor women. And so one of our largest concerns is, securing that pathway, not having that same pathway happen in Nevada, but looking at it in totality, right? How we look at reproductive justice and how can we get support and get behind Black, brown, and poor women now so that they can equip themselves with the information that they need to protect themselves today. We know that Black and brown women are 4 and 5 times more likely to die in childbirth than their white female counterparts. And oftentimes they aren't taking the precautions necessary to prevent, but then also not knowing and having access to take care of. And so we are advocates for the information, but more so we are great partners to those who provide the resources. So, we try to make ourselves available to Planned Parenthood and to NARAL and partner in the places where they're doing the movement and they're doing the work, because, sometimes just being a good partner is what you need to be. I think we take for granted how much power serving has. And I, for one, personally, I know that, there's nothing more powerful or more gratifying than serving. But then also when you can get behind work that is already done, it just makes that work even more effective and more powerful. So we're really consistent in doing that. And even more now, in the last year, we've been practicing. Our practice is being a better partner. And that is intentional. one of the other things we're doing at Make It Work Nevada is we're trying to expand the conversation around reproductive justice, right? Because we believe that it has to include not just abortion access, but also physically giving birth, but then how that environment looks for those children and for those parents. All of that is reproductive justice. And we like to focus on the intersection of that. We don't talk about how those conversations expand past families. For example, in Tennessee, students and teachers can sue a school if they are allowed transgender students to use the restroom. Right? That's a reproductive justice issue. And in Florida, the same law exists where the parents can sue the school if that child is playing a sport that they're not identifying at, right? So what those things affect all of it. Because if you put people in position where they can police people, right? Then what happens is we're opening up the arena for it all. When you open up one door and you say it's okay over here, then they're saying, oh, this is the trickle down effect because you've already said it here. We're able to use that as a precedence, and then we can move policies along that will counteract women and persons to have authority over their own bodies. And so we want to, just be mindful of when policy is coming, and because we shouldn't be policing bodies, period, right? Not just women's bodies, men's bodies. We shouldn't be policing bodies, period. I do not like that. I don't even like having conversations about it. I just don't want Personally, I don't like anyone having authority over the decisions that I'm making about me, my body, my son. I always tell my son I'm the ruler of all things Anwar. I don't want nobody else thinking that they have authority over me and the decisions that I'm making with my son and myself. And so when we allow one decision to be made, then that is opening the doors for all the decisions. So we got to be really mindful of the policies and how it deals with persons and their bodies and their environments for their families. But, right now what we have going on at Make It Work Nevada, I could really use some help. I usually don't have a call to action, but the doula bill, I don't know if you guys know, but a doula bill passed last policy. It was Make It Work Nevada's leading bill, and it's AB 256. And so what happened was there's a designation that has been made to the Medicaid so that persons can get reimbursement on having a doula. So we know that this will increase birthing outcomes for Black, brown women and poor women, right? And so as we are rolling this designation out, what I'd like to do is really put ourselves in position to have a really good program so that when we go back to legislation, we can say, hey, you're not paying our doulas enough money to provide this great care, right? This great support for these parents. And so we will have we already have a button at makeitworknevada.org where you can give donations. It hasn't been designated specific, but we're not taking donations for anything else. So I can just tell my executive director, that's my money, right? But what we're trying to do is put a cohort together of doulas that will help us go into the communities and find these mothers and bring them into their space to provide those support for free. We want to give access to those mothers, to those parents, so that they're not out here just trying to figure it out. And it's really essential right now as we're in the pandemic, because what they're finding is a lot of people aren't going for care because of the pandemic. And so having doulas right now is essential. It becomes essential for those mothers to make sure that they are getting the support, and then those doulas are partnering with midwives to make sure that they're getting that care. Because what we want to increase birthing outcomes. That is always our goal. It's always what we're looking for. We're looking forward to that, looking ahead to that and what that looks like in its totality. And so this will help us do that. So you can go to makeitworknevada.org and make a donation. And I have ran for office right now on this call. I appreciate it.
Well, we're glad to hear you're running for office.
No, don't tell nobody that.
Not yet.
Don't tell nobody that.
You want to make sure you put the link in the chat, or someone might, oh, somebody already did. So good, because we want to make sure we have that for people to see. And thank you so much. And we look forward to working with Make It Work on any of the programs that you have, and we'll make sure we promote them. So
thank you very much. And I also, My Body, My Authority is our conversation. It's every second Tuesday of the month, and we talk about reproductive justice and women taking control over their bodies.
Is that something we can find on the website as well?
Absolutely.
Okay, we'll make sure to let people know about that. Ironically, I was at the school board meeting the other night, and they were using My Body, My Choice as their chant about not getting the vaccine. And actually, Zoe Nicholson in Long Beach was at a meeting last night where they were using that as well. And she thanks them for being pro-choice and for supporting abortion, and that didn't go over well. It's just, the irony is just, it's just terrible. So, but thank you
now for having us. I appreciate it.
Oh, thank you. I look forward to meeting you at the Merge event. So, so next on our agenda, Carla, I'm going to probably say this wrong, Ramazan, close. She created the Wild West Access Fund of Nevada. It's the only abortion fund in Nevada. And so we wanted to make sure to hear from Carla and make sure she lets us know how we can support that. So thanks for joining us, Carla.
Fantastic. Thank you so much for having me and the rest of the fund. So to start off, I want to share a story with y'all as to why this issue is something that is very important to me. My mom is Romanian. I'm half Romanian. That's where I was born. And as some of you might know, Romania is often a case study for how not to do abortion laws. For the longest time, they had a strict anti-abortion policy in place. And my aunt, she had an unsafe abortion and she was killed by it. So it's something that is very important to me, and especially right now with what's happening in Texas and feeling like it's trickling into other states as well, such as Mississippi. I'm just so concerned because I know how this affected our family, and I'm, terrified of the repercussions for others, given what is essentially a total ban on abortion in Texas. Anyways, on to the Wild West Fund. So the Wild West Access Fund of Nevada, we launched in June of 2021, and what made it feel so urgent is we realized there wasn't currently an active abortion fund in Nevada. And I was raised in Nevada. Nevada means so much to me. So that's where we came in and we were like, wait a minute, let's see if we can make something work. The inspiration for Wild West Access Fund was actually a fund in Texas called Buckle Bunnies Fund. You might have heard of them because they are getting so much, press attention right now, given what's happening in Texas. And I was just so inspired by their work and the way they were doing it. So we set up a call, asked some questions as to how to do it. And the idea was, we'll try to replicate it in Nevada. We'll see what happens. If it doesn't work, that's okay. But we can try to make a small launch in June, see if there's traction, see if people rally around it, and go from there. Fast forward to September, we have grown exponentially. And we have recently filed our 501c3 paperwork with a lawyer. We're waiting on our tax exemption. We're the real deal, and we've been funding people as a mutual aid fund ever since June. Unfortunately, thanks to grassroots supporters and to the outpour of just community support and love, we've been able to assist close to 30 callers so far with an average pledge of $300. In Nevada, we are normally looking at about $600 for a medication abortion. For a surgical abortion, the costs go higher, and they rise exponentially depending on how many weeks you're out. So we're able to make quite a dent for people, and we do work on a case-by-case basis. If we have somebody who's able to cover $500, we'll supplement the $100 that's remaining, but we have some callers who are unable to cover anything, and that's where we really get to work, and we fund as much as possible, if not the entirety of the procedure. As to how we do it, we have a website where we have an intake form that anyone is able to fill out. We ask a few basic, as least intrusive questions as possible, asking if you have an appointment yet, how much of your procedure you would be able to cover reasonably, when your appointment is, et cetera, and how we can best contact you, whether it's by email, by phone, and then within 24 hours, but honestly, our volunteers are so good at their jobs that we're normally in contact with you within 1 hour or two. We'll reach out and we'll schedule a phone call, and that's where we ask exactly what clinic you're going to, what date and time, so we can establish contact with the clinic to send a check to them. And then we ask if you need any other resources, like if you want us to connect you to some other resources following the abortion, etc. And we go from there. To give some like anecdotal testimonies of what we've seen, the majority of our callers, they come from low income backgrounds. So it's so important that we're here and able to assist them, because there are some that, might not be able to keep their appointment if we weren't here, or they would have to resort to other like more drastic means. So it just feels so fulfilling to be able to step in and to help those people. We had one caller who had to travel to Colorado because she was about 26 weeks, I believe, and no longer eligible for a procedure in Nevada. And, now I'm thinking about her story and what happened there. And I'm thinking about how it's going to be mirrored from Texas to Nevada in so many ways. We worked so hard on that case to be able to connect her to other resources, to get her to Colorado, to fund as much as we were possible. And now we're ready to do it again for people who have to travel from Texas to Nevada. So because we are entirely volunteer run, every single penny that we get, it goes straight to people's procedures. This work means so much to me and to the team that we have. We have about 10 volunteers on board, and we have 10 volunteers and a board of 7 people is what I'm trying to say. And we have our first board meeting tomorrow. We have quite a few people who are very involved in like Nevada and repro justice. So thankful to have them. And we're so excited to see where this goes. The goal is to have a permanent long-term resource for Nevadans. So I will go ahead and drop our website link in the chat. You were able to make a donation on there. And if for some reason you would rather wait until we have our tax exemption status to make a donation, you can go ahead and send us an email and we will be in contact as soon as we have it for you to do that. I'd also encourage you all to follow us on social media. We have an Instagram. That's normally how people find us. The beauty of having a bunch of 20-year-olds behind the scenes is that we know how to work Instagram. So we've really been popping on that platform, and we have a Twitter and a Facebook as well. And you can read more about our board members and our volunteers on the website. I'll go ahead and pass it back to Jerry, but thanks so much for having us. We are so excited to be here.
Well, we're excited to meet you, and I hope you'll put some of those links in the chat, especially the Instagram. I know Maya and Morgan are my 2 people that are always on Instagram. I need to do better, but they have a lot of students that are interested in hearing more about what we're talking about today, and that would help. And then, make sure I see you're putting it in the fund that we could donate to. Any information we can help. And then you mentioned volunteers. Do you have a need for more people to help it? And what kind of volunteer work are you looking for?
Yes, absolutely. I mean, the more the merrier. We right now, I think our biggest need would probably be intake. So those are the volunteers who establish contact with the callers and ask the questions, and then we come together and just like figure out how to get from point A to point B. I'll drop our email in the chat, and the best way to get in contact with us is just to send us an email, or you can DM us on Instagram. I don't really care. We check them all. And we'll be in contact with you about setting up a Zoom call to just do a brief like screening. We take the screening process seriously just to make sure that we don't bring in anyone from the opposition, and then we'll go from there.
Thank you. So our next and but probably not our last speaker, because we're going to have Poppy hop on, and there's a couple other people we might, I know Audrey was going to tell us about some actions that we might be working on together. So Bernabei has joined. I was reading an article about how difficult it is for trans and non-binary people with abortion, and just even the language. Most are women's clinics, or, just the feel of that. And I thought of talking to Sai and wanted you to come and tell us how this is affecting trans and non-binary people. And you always teach me, Sai, so thank you for joining us.
Thank you. Can you hear me?
I can.
You can hear me, great. I'm Italian, I'm loud, so you're gonna hear me regardless whether I'm on mute or not. So hi, thank you so much, Jerry, for inviting me and giving me this opportunity. We are so often left out of this conversation when we were talking about reproductive healthcare services, or really healthcare in general. And I'm often invited to basically queer things up. That's what I do. That's my job. And I've been doing social justice work and community organizing for almost 25 years now. Since I got out of college, I've been doing this work. And I want to say a couple of things. First of all, I've been a proud feminist since I can remember. My mother raised me to speak up for women's rights and for abortion access. And I appreciate sharing space with all the traumas First of all, let me tell you about gender justice real quick. What we do, we're a local 501(c)(3). We're in Southern Nevada, but we do reach out and do work with the rurals. We do policy work, but we have to be very careful because we do not have a C4. So we have to be very careful. If you want to know my political opinion, you can go to my Facebook page. I put it on there a lot. So, but as far as our organization goes, we do help with policy work. We look at language and that and how inclusive it is. We do empowerment. We have a speakers where I train folks who are trans, non-binary, anybody really in the alphabet mafia to speak truth to power, how to testify, how to talk to media, how to share their story to open hearts and minds. I do education. So a big part of my job is training healthcare providers, educators, therapists, business owners, anybody who needs to know how to support the LGBTQ community better. A lot of times and I include anybody, folks who work at Planned Parenthood, folks who work in clinics and places, who all are medical providers. And the fact is that 27% of trans folks are outright refused medical care. We are seeing legislation state by state where we're looking at these like religious freedom laws, right? Like in Ohio, where they're saying that even if you're a paramedic, if you disagree with someone's lifestyle and you morally object to it, you don't have to give services. You don't have to, give medical care. And when we look at the language of all of these things, right, the average person doesn't sometimes understand, and the word of mouth gets around like, don't call 911, don't go to the doctor because you can be refused care. And when we talk about discrepancies in healthcare, LGBTQ community suffers a lot because of these, horrible pieces of legislation. In talking about reproductive health care, I'm always pushing for more inclusive language. So I'm always pushing for folks to say, like I heard earlier, I loved somebody saying parents, things like birthing folks, chest feeding, people accessing abortion. Because here's the thing, I identify as queer, as trans masculine, and as non-binary. I don't identify as a woman, although I have a uterus. So these laws directly affect me. And if I was living in Texas and many other states, I would be very scared because not only on top of being marginalized within a community, I also would have the same issues in accessing care. There are many folks in my community who are on birth control. There are many folks in my community who are assaulted and afraid to go to use the shelter system or go to have a kit done. I'm using kind of coded language right now because I have 7-year-olds that are probably listening. So, but the thing I really want to stress here is to include folks in my community in these conversations. We are directly affected by this, but we are very afraid of going and seeking out these things. And when people talk about like statistics, like, okay, let's talk about how many trans folks had abortions last year. It's very hard to find those numbers because at the clinics, they're often not extracting the right data. So if I go to a clinic and it says, how do you identify man or woman? Sometimes I just say F you and make my own box, but often they're just going to put me in the category of female because that's their binary concept, right? So it doesn't really actually say that I'm non-binary and I am, requesting reproductive health care services. So in feminist circles, in reproductive justice circles, in all of this, what our organization really wants to push for is education. I would hope that anybody right now who is a social justice warrior, when we're talking about trans folks, if we all say, okay, trans men are men, then understand that men have periods and men need access to abortion and men need this care. And I know that that's very hard. I know there's certain waves of feminism that have been very exclusionary to our community. And not just for trans folks, I'm talking about like the lesbian community as well. Like we can just look at the sex wars. If you look at history of the feminist movement in the 1980s, where they pushed, especially butch lesbians aside and didn't include them in on the conversation. So what I would like to put out there for you is, and I dropped some of the stuff in the comments, reach out to me, please. If you think that your organization does not know terminology, does not know pronouns, does not know the WPATH standards of care, which all medical providers, if you're serving folks in gender diverse communities, should have knowledge of. understand about gender affirming procedures, things like I've had top surgery, and a lot of times I have to explain to medical providers what those surgeries and procedures are for, and just update your understanding of my community. Please, I'm begging you, it's so necessary. And when we are organizing for these things, it's okay to say Women's March. I get it. I'm going to be there. I'm going to have my signage and everything, but I'm also going to be stressing that trans folks, non-binary folks, lesbians, all of us need to be in on this march and doing this work. So education is key. This Friday at 10 a.m., I'll be doing a Zoom. I kind of call it like a trans 101, right? So terminology and all that stuff. And what I can do is I usually kind of customize it to the group I'm kind of teaching to. So if you're teachers, I'm going to talk about how to support trans students. And I know somebody talked earlier about sports and access to healthcare for young people. This is all so important. This Friday will be a general 101, but I can always kind of customize it to whoever I'm teaching to. I would encourage you, please, to be as inclusive as you are when talking about these issues. Because the minute we are more binary and the minute we are more limited in our language, we turn people away. You know, this movement has historically been transphobic, homophobic, racist, ableist, all of those things. And so I encourage you to have those courageous conversations with your colleagues. You know, if those of you that are working in clinics or those of you that are doing political organizing, say, how does this affect the trans community and how can we include them and let them know that we are a safe space? Because oftentimes we're not connecting with people because we don't think it's safe and we don't want to be harmed. So we're left out of the activism. And it's really important for us to be at the table. When we talk about intersectionality, which I think we know what that means, we have to look at that. I'm a feminist, but I'm also a feminist and I'm a trans person and I'm a non-binary person, but I'm also all of those things, and I have a uterus. So I think that covers everything. Sorry, it's late, so it's probably not my best elevator speech. But if you have any questions, I put my number there. Please text me or email me or reach out to us. We're on social media and just check out things.
Thank you so much. And you can see why I always invite Cy. And one thing about Cy, I can make mistakes. I can ask questions. That's, it's hard for us. We're learning and we're making mistakes, but Cy will always support and be a ally to us, and we're an ally to you, Cy.
Yeah, wait, I just want to say, because Jerry, you remind me of something. I want to say something, that everybody can be a better ally. I need to be a better ally to other communities. We are all constantly learning. Give me a second, buddy. Hold on.
Cy has twins.
You don't even know what the emergency is right now. It's pretty bad. It looks pretty severe. Yep, I see. Knives. That's real great. Knives. Real knives. That's great. Way to go, buddy.
You would never say that.
After I get this call, I might have to call 911.
You would never.
Listen, I just want to say that whether your intention is to harm or not, because most of us don't know that the language is harmful, the impact is still the same. So if you're saying terminology like transsexual, or you're saying things like sex change operations, or, things that are antiquated and old, it is harmful. So whether you intend to harm us or not, it's still the same. So please be educated.
Thank you so much. And make sure you put in your program for Friday in between emergencies. So thanks for joining us. So real quickly, before we get to Poppy, we'll have Poppy come on.
Sorry.
So I wanted to, one of the reasons I have Maya and Morgan on, there are students that have a Loud Girls Club at their school, and we went and met with Cy. One of probably the only in-person thing we've done so far, but I've been trying to mentor and help them. So one of the things, if you want to reach out to us, they're looking for speakers. They have speakers like weekly, right, girls? And there's a lot of great people here that we can look to. So I just wanted to mention that. And also, Audrey, do you want to quickly talk about an action that we're working on before we go to Poppy?
Sure, thanks, Jerry. This all just kind of happened. I'm Audrey Dempsey, for those who don't know me. I'm the president of the Nevada Federation of Democratic Women. And I just got a email today from National, and they're suggesting that we do an event on September 17th, which is next Friday. It's Constitution Day. And so I talked with Pat Spearman and I talked with Jerry, and I said, we need to do something, you know, we need to get out there and make our voices heard. And so one of the suggestions was to write specific letters that we take around to all of our congressional representatives, both Senate and House. And so we're going to try to put that together for next Friday. And you know, it's not going to be a big rally kind of thing because neither one of us can do that right now. But at least if we have a pretty good sized group, we can cover all the areas. We can know that on the 20th of September, Congresswoman Judy Chu's Women's Health Protection Act, which is HR 3755, would codify Roe versus Wade. And so that's definitely going to be one of the actions in these letters, of course, along with, you know, what's going on in Texas. But we need to protect nationally to not see Roe versus Wade go down the toilet, because we worked all too hard for that. We also need to get the ERA ratified. So we're going to make that part of it. And what was the third thing we came? Oh,
the filibuster, because none of this will happen if we don't remove the filibuster.
But passing HR 1, you know, the Voting Rights Act. So those are the three things that we want to go after. Well, four things actually. So because nothing is going to happen if we don't get rid of this filibuster. So anyway, anyone who would like to participate with us, we haven't got it really quite organized yet because we just talked about it today, but we're talking about meeting at the federal building and starting there, and then kind of breaking up in maybe two different groups, and, you know, some people going to the east side of town to Susie Lee's office, and then Dina's office, and then out to Horsford's office. And so I think that if we have we can make some signs, and maybe we can get some press out there, and we can get a little action going there. So that's our plan. I'm happy to put my information in the chat as well. Feel free to contact Jerry. I don't have a time yet because we tried reaching out to the offices today, and we're still working on that. So it's always better to have an appointment if possible. If not, we're probably going to go anyway. So because we're ballsy women. Can I say that?
Of course you can.
So anyway, I would venture to say, you know, especially because it's still hot out, maybe if we get there around 9 o'clock in the morning and start from there, we probably could be all finished by noontime anyway. But at least we're taking some action and making our voices heard with our congressional representatives. That's their job.
Thank you. And I'll be helping you put that letter together. Anybody wants to co-sign on there, just let us know. You don't necessarily have to go with us, but you could be on the letter. So
absolutely.
Yeah. So thank you.
Thanks, Jerry.
Yeah, thanks.
What an amazing group of speakers tonight, too. Really enjoying it.
It is. It's been wonderful. I've seen other people hop on and off of different names that Claire Thomas is on. We didn't mention that Claire's here. So that was one of the other electeds. I think maybe Claire hopped on when we weren't looking. So, so let's get to Poppy. She can kind of wrap us up with what's going on in Texas. And, you know, Poppy, one of the things I didn't mention earlier that I noticed where they were talking about the 6 weeks and that it's not realistic, that, you know, women don't know that they're pregnant, and, you know, and people don't know, for, you know, that might just give them like 2 weeks in order to do this. And so that's just one of the things I forgot to mention. So can you update us on what's going on the ground in Texas?
Well, it's hard to know where to start. because there's so many things. But I will start with something that, because you're from Nevada, you know the saying about what happens in Vegas stays in Vegas?
Yeah.
Well, what happens in Texas does not stay in Texas. Okay, and that's very impactful, not just not just in terms of this particular statute, but with regard to what's going on in terms of redistricting and so forth. Texas is on the verge of turning blue. Okay, and that is part of why all of this is going on. Okay, it's a big part of it. The demographics in the state have been changing. We had a guy, Beto O'Rourke, who ran against Ted Cruz, the most hated man in America, who's one of our senators, and came close, okay, like shockingly close. And then the other thing that is going on is that we are increasing our population, and the population that's coming in is more liberal, more progressive, as well as increasing the representation of the color of the state, okay? So all of these things put the Republican Party, the state Republican Party, and the national party too, in great peril. Because Texas has 36 congressional votes right now, and they're going to go up to 38. Okay? So it's a big enchilada, and they're in danger. So a lot of the stuff is reflective of that. And also what's happened with the Supreme Court in terms of the change of the balance. If the balance had not changed, I doubt this statute would have been crafted, to be quite honest. Okay? The anti-abortion people are very strategic. I don't like to say they're smarter than we are, but in some ways they are. Mainly in the sense that they're more focused. And they wrote a statute that was specifically crafted to take advantage of the change in the court. And it was also crafted specifically to avoid judicial review. They saw an opportunity. We have the Supreme Court coming up looking at abortion as a whole in this Dodd case out of Mississippi. It's probably going to be decided in June. And they saw a way to do something right now that's very dramatic. And they crafted a statute that totally turns the law on its head. Its actual significance is far greater than abortion, okay? The content, the substantive content of this statute is almost a detail if you really want to look at the horrific nature of the law. What they have done is they have taken a legal framework, and across the country we basically have a legal landscape that is meant to be fair to litigants. It's meant to be a level playing field, a fair playing field for justice to be served. They have taken that concept and turned it on its head, and they have created what is essentially a one-way street of justice. The statute, you have to read the thing in detail to actually get all of the ways in which they have subverted justice. And, people find it hard to believe it. I say, actually, the worst part of this is not what it's doing to abortion. The worst part of this is what it's doing to our system of justice. Because not only are they creating a vigilante system, okay, they are also saying that the defendant's attorneys are liable to have to pay the fees, et cetera, et cetera. So how do you hire a lawyer who's going to represent you when they're opening themselves up to liability, okay? So they're not only trying to scare off the people who are assisting in a more direct path. They're trying to keep you from even having representation to protect you, to fight for you. That is totally alien to anything we've ever seen. And, you know, for that reason alone, the Supreme Court should have picked that thing up and said, ripped it to pieces and said, I ain't happening, okay? But they didn't. And there are, like, every time I read it, I find another gotcha in that statute. It is that bad. But we are where we are at this present time. And in Texas, I mean, we're having to deal with, I think, 3 different layers of things. One of the things is what most of your speakers, previous speakers, have talked about, and that is trying to get some aid for the women who are immediately impacted. And that's needed, okay? But please don't buy into the idea that that's where most of your energy should go. Because that is, to be honest, a Band-Aid solution. And we are like having a limb cut off. We are hemorrhaging, and a Band-Aid is not going to do it. We have a machinery that is producing this disaster. And there's no way we can airlift, 50, 60,000 women out of the state of Texas every year. And if this expands to the adjacent states, now you're talking about even more. Okay. That's a ridiculous proposition. So let's get real. Okay. We have to find other ways. We have to deal with reality. We have to deal with the long-term problem, and we have to deal with the short-term problem, and we have to mitigate. Okay. Now, sometimes there is a little bit of lemonade that you can make with lemons. And one of the things that, I would suggest you try to do is stop using this word that it's banning abortion altogether. Abortion is still legal in Texas, and using that kind of language is telling a whole lot of uninformed Texas women that they can't get an abortion at all, okay, which is not true, okay? We don't want them to think if they are under 6 weeks that they can't get an abortion, but you have to understand how, people that are low information, they just hear that ban word and they think I'm dead. They don't think, oh, there may be a fund that'll fly me to Albuquerque. They just think they're dead, okay? So, process that a little bit whenever you're talking messaging. Now, the other thing in which it makes a little bit of lemonade is that finally we're going to have some people who are going to start talking about trying to do a little more education to people and trying to provide more resources to people to get birth control, which is good, to talk about, and to motivate people to, be that safe space for the teenagers that and go out of your way and talk to them, okay? Do you know what to do? Do you know that you need to get a pregnancy test? Do you know that you can come in? I'll get you a pregnancy test. Do you know that I have Plan B in my household and I will get it to you, okay? And get them birth control and make them understand they do need to get tested. They do need to have a pregnancy test early and so forth, rather than, running them all off by saying you can't get an abortion, okay, in Texas. So that part of it would be good if more people would get on birth control and, take the preventative measures. That would be a little bit of lemonade to make out of this. And we do have more people that are a little more interested in that these days. It's raising conversations that have not been had before. The people who are the worst hit of all are actually the girls that I represent, because I'm a referral lawyer with what's called James due process. I don't know if y'all have a judicial bypass law in Nevada. Can somebody who's 16 get an abortion, or do they have to have parental consent?
We have a blocked parental notification law that was sued, Planned Parenthood sued over it, and so it's never been put into effect. However, there is court precedent right now that's being reviewed. And Poppy, I can't believe I'm even telling you this. Sorry, I like feel very intimidated and kind of sweaty talking to you about this because I know you know a lot more than I do. But yes, so in our state, we're potentially could go back into effect, but it's never been in effect here.
Yeah. Well, I mean, you're lucky, but I represent pregnant teenage girls day in and day out. I probably represented more than anybody else in the whole state of Texas. I was appointed on the first case that was filed 20-something years ago when they passed that statute. And in fact, I was in court. I was dealing with a girl all day yesterday. And a tiny piece of good news, okay, is that because I have seen this train coming down the track for 12 years, okay, I was not surprised. And when the legislation was first filed, I knew it was going to pass because I count noses. I know what the vote count is, okay? And it wouldn't have mattered if we had had 100 million people in Austin. It was going to pass because we do not have the votes in the rural areas. So I have been talking to the refs, okay, for months in Harris County, which is where Houston is located, where most of the abortion clinics are, letting them know this was coming and letting them know that we were going to need to be able to take these cases through court like a rocket, okay? And we now have a blue courthouse, okay? Every judge elected is Democratic. Totally different than 8 years ago. We have flipped, okay? Which explains some other stuff about what's going on in Austin. But anyway, we are now trying to process these girls through and are succeeding in processing the girl through. Yesterday, I met her at the clinic at 8 o'clock. She got her ultrasound. I got her in front of a judge at 3 o'clock. So she got her bypass by 3:30, and she had her abortion this morning, okay? So at least in Harris County, which is the biggest city, okay, the biggest area, we are moving these girls through without delay. But if a girl, you want to talk about who's the most impacted, poor women, yes, but we can, I mean, you can raise money to help the poor woman, okay, if you can communicate with her. But that teenage girl who cannot tell her parents, and she's 12 weeks, I can fly her. So what if I have the money? She cannot leave town. I mean, what's she going to tell her mom? I'm going to be gone for 2 days? I mean, those are the ones that are the most critical, okay? And that's part of why we need to educate these girls really, really intensely to get on birth control, okay? Get on birth control now, know about Plan B, and test, because, you know, even before this, you know, if I hadn't to run into a judge that would deny me, I mean, yeah, I can fly you to Alabama. I had the money, okay? I could get the money to fly her, but I couldn't get her out of town, okay? So those are the ones that are the most affected of all of the people are the teenagers, okay, in Texas. And it's going to be the same, you know, if this thing goes into the other states around us, because we have those girls coming in getting abortions in Texas already, okay? So they're already locked out. But mitigation is one of the things that we have to do in terms of educating people and getting them to understand this. The other mitigation that I've been trying to get going is I have a history in the space program. I was the first woman in mission control. So a lot of people in the space program know my name and follow me on Twitter. And I've been trying to get a conversation going about federal properties, okay? NASA is where I have, you know, an ability to talk to people, but that's not the only federal property. So, you know, there's something called sovereign immunity. And I think that we need to try to get federal property, federal people, federal employers to push the limits, okay? and maybe make federal property safe space. They, you know, if they may not be able because of height to pay for an abortion, but what about if they were a safe space where a woman could go there and make her telemedicine calls out of state and get her medication delivered on that site and take it on that site? Okay. Would state officials be able to come in there and make a bust on a federal, federal place? And I don't know the answer to that. But what I would like for people to do is to start pushing these limits. There is a lot of federal property in the state of Texas. There's military bases, there's post offices, there's NASA, there's Veterans Administration, and that's true throughout the South, okay? If those federal people would push it, okay, we could at least expand medication abortion up to 10 weeks, which would help, and become involved and committed and get that conversation going with women that work for federal employers to try to get employers to understand they need to be taking action and they need to be getting involved and they need to be raising their voices as well, because this affects their workforce. The affluent women who are engineers at NASA, they're going to be able to fly out of state, okay? But not everybody that works there is going to be able to do that. So that's one of the conversations I'm trying to get going. And I've gotten a flight controller, a young woman at NASA. I mean, she wrote an open letter to Nelson about that, about wanting him to start speaking out. And that's the other part of it. This is something that you can use your influence to get other influencers to use their influence. Merrick Garland from the Department of Justice has said, oh yeah, I want to do something, except so far he hasn't done shit. So, if you can get your congressperson to start leaning on Merrick Garland, okay, if everybody will start getting all of these people to lean on Merrick Garland, maybe he will get off his butt and do something. Maybe he will sue them under Section 1983 of the Civil Rights Act. Maybe he will even turn the law upside on its head, and this may be what he has to do. Our statutes turn the law upside down, okay? He may have to sort of take an approach of turning the law upside down. He may actually need to sue the abortion clinics for depriving women of their rights under color of state law, which sounds totally crazy. But remember, we have a statute that's totally crazy. If he sued the clinics, they could then say, but I got a gun at my head from our state law. And that may be the way that he can get to the law. But whatever it is, he needs to find a way to get in court. And he needs to find it soon. He needs to find a way to help federal property become safe spaces. He needs to find a way. I mean, maybe your congresswoman or congressman's office could be a safe space. Who the hell knows, okay? But they need to start having creative thinking about what they can do, not just lay down and take it and not just say, oh, well, this doesn't, this was not meant to be done this way. They need to be innovative. And that's why I enjoy talking to the space people, because they understand what I'm talking about. Because I say, you should look at this like Apollo 13. Okay, so what if the main engine blew up? You don't just say, oh, well, shit, we can't get home. You say, oh, well, we got this other engine. It doesn't matter, it wasn't designed for this. We will find a way to bend it around and make it work to get us home, to get some relief. Because long-term, the relief we have to have is we've got to change the makeup of these red states in the state house. We've got to have Voting Rights Act, okay? And we have got to have codification of this Women's Reproductive Health Act. But, that brings up influencing cinema in Arizona and Mansion in West Virginia, they're our block, okay? So we've got to find every way we can to influence them. And again, maybe it's federal employers. I mean, all of these people that we can turn on to start pushing and using their influence to move this thing on down the road. And we've got to get the Biden administration to govern as if it won, because they did. Somehow or another, a lot of times when Democrats win, they want to act like they lost. They're so cautious. But we've really got to lean into this thing. We have a women's vote project in Texas that is very effective. That's what turned Harris County blue. And it's going statewide for the 2022 elections. And I'm going to be also working on trying to get a data project going for targeting voters that way, to help in that endeavor. But, this is going to hemorrhage across the rest of the states if we don't shut it down as fast as we can. And, that's going to take, as I said, Merrick Garland needs to come in there. They need to know that, an 800-pound gorilla is going to be there. And that's the Department of Justice. I'm happy to answer any questions. I'm tired, okay, because trying to help these girls through the system, like a rocket is exhausting, because I also, I have to not only get them through the clinic and get them through court, I also have to get them the money. And it's not that I'm getting the money from other agencies, but I have to hook all this stuff up. So, I'm 78 years old now, and I feel like I'm about 98 years old from all of this.
Well, I appreciate you joining us. I was hoping to get you, and I wasn't sure. So when I saw you were on, like, oh, we got to say time for Poppy. So it's amazing to meet you. I heard you mention about the Apollo program. I've been reading about you for many years. So thank you for joining us. And please.
Well, you can follow me on Twitter.
Good. Well, and also I'd like to be able to contact you, and we can talk about how people in Nevada can stay in touch and help with some of the programs you're talking about. We can learn a lot from you. So
I'm easy to find on Twitter.
Oh, good. Well, that's
with a name like mine.
Yeah.
With a name like mine, it's very easy. And, just find me on Twitter and DM me, DM me, and I'll find you, Jerry. I don't know what your last name is offhand, but everybody else DMs me, so there's no reason you can't.
Well, good. I plan on it. So, and if anybody had any questions for Poppy before we go, Consuelo, you had your hand up. You're on mute, Consuelo.
Hi, Poppy. So nice to meet you.
Hi.
My question is, I just saw somebody in the chat wrote down something like Biden administration just announced that they're suing Texas. Is that true? Did somebody just put that down?
I don't know.
Yeah, and what would that mean?
I don't know. I hope so.
What would that mean?
Well, I don't know, but I don't
know.
I would have to see what
it was breaking news from the Wall Street Journal, so I just put it in. It was just an alert on my phone. Thank you for everything you're doing.
So I hope so. I want that 800-pound gorilla in the courtroom.
Thank you, Poppy.
I'll go look at the Wall Street Journal tonight.
Absolutely. Did anybody else have anything? I don't know if Senator Spearman can hear me. I see she's on mute, but she joined us a little bit late. And Poppy, Senator Spearman is she often says this isn't true, but she's the reason that Nevada ratified the ERA. She was the one who carried it, our state senator. I don't know if you've ever met Senator Spearman, but she's amazing.
But that's great.
It is. Senator, can you hear me? I don't know if she's on another call.
Yeah, I can hear you.
Oh, yay. Well, Bob, we're kind of at time, but I still wanted to ask you, and I didn't know if you heard what Poppy was saying. How will the ERA help some of these things? I think my opinion is we've been too careful with abortion issue and ERA, and now here we are. So what are your thoughts on that? If you could, give us a little, I don't know if you could inspire us. It's all very depressing, but.
I think when you have it, it cuts both ways, because one of the things that the states who wanted to rescind, that's something that they always use, and it's a hot button issue. And it's amazing to me when you go back and you look at the history of abortion, it really was not created as a litmus test as to how religious you were. It was really created as a way to start to tamp down other people from voting, and to make sure that underrepresented communities never got there. And they figured out sometime in the 70s or whatever, when the moral majority came into, and they started talking about it, as though they got it from the voice of God. I don't know that the ERA talking about what happened in Texas, I don't know that helps us. I think internally, if you think about what equality means, then yeah, I like what somebody, I saw something in, I guess it was either Twitter or Instagram, somebody said, and so if that's going to be the law in Texas, then we ought to outlaw Viagra. We ought to, look at other ways that, quote, men are able to do whatever it is that they want to do. And from a biblical standpoint, anyone who involves themselves in a personal massage, shall I say, in Hebrew law, they were to be stoned. And so nobody talks about that, but if you want to go there, you go there. But I don't know that this particular issue helps people. And Poppy, I was in Texas, a station Colleen in San Antonio, and Colleen, San Antonio, and then I did my command general staff in Austin, and that was during the sane times. And after Governor Richards left, it was like, I don't know. I have no idea what they put in the Brazos River, but it just kind of went to crazy time. So those are my thoughts, Jerry. I don't know if that
did
helped.
indeed.
Yeah.
Well, and on the ERA, you have to understand, Texas has an equal legal rights amendment to our state constitution. Okay. The key is not, having the amendment is one part of the solution, but the other part is you have to have the court. Okay. So you have to have the justices that will follow the amendment, because we've got a constitutional right to abortion right now, except we have a court majority that won't follow that. So it's right now, I would never want to take anything under our state ERA. I keep telling people, do not even dream of litigating under the state ERA. We have a horrible 9-0 court, Republicans, and the only thing that will happen will be really bad law. Now, we change the makeup of the Texas Supreme Court, then we could do a whole different number using the ERA. So you've got to have both parts of this. You've got to have the court that's going to follow the law, and you've got to have the law.
And another reason for expanding the Supreme Court is that somebody else had mentioned that in the chat, that's an idea we need to push. So,
yeah. Jerry,
if we can't get the filibuster,
none of this matters. I know we don't get the filibuster, not voting rights, not ERA, abortion rights. It's all, like you say, the courts really matter. So, Senator, you were going to say something?
Yeah, I was just going to say one more thing. I don't know what they're doing in Hays County to capitalize on the fact that it almost went blue in 2020.
Right.
That was almost unheard of, and I don't know if it went completely blue, but Hays County is that part of it's the corridor between Austin and San Antonio, and it's usually Bubba country, and for that to get that close to blue, and if there was a way to capitalize on that And I think part of that, to your point, Jerry, in terms of, you know, what it does for the ER, I think this drives home the point that while we're waiting for the archivists to do whatever they're supposed to do, we have to be working on hearts and minds. We can't just sit back and say, oh, well, nothing's happened. We've got to be working on hearts and minds. You don't have to say that this is good for abortion, but what you do say is that we've got to make sure that people recognize women as equal. So.
And I don't know if Poppy knows, but Nevada is the first female majority legislature, and one of the reasons why we've been able to pass a lot of legislature through. So
I'm excited.
So your idea of turning, you know, blue is certainly now is, as you know, nonpartisan, but we support, you know, our candidates according to issues, and we need to elect more of those type of candidates.
The county that she mentioned, Hayes County, I know exactly who she's talking about. Okay. Hayes County, and she'll know who I'm mentioning whenever I say Williamson County as well. Williamson, Hayes, and Comal are all up in that. Well, Comal is not anywhere close to blue, but Williamson is, okay? And it's similar to Hayes County. And that's that voting project that I'm talking about that turned Harris County blue 6 or 8 years ago, okay? That voting project expanded. It's a women's voting project that targets registered women who are low propensity voters. Project targets those women, and that's how they turn Harris County blue. And then we're really going to try to focus on. Okay. Anyway, it's great meeting y'all. I got to go eat.
I know, but I'd like to. We'll contact you about that. We have several people who are wondering how to help with voting in other states and getting people out to vote. We helped in Georgia. We've helped in some of the other states. So I just texted my board and said, let's check out that voting group, because it might be something that we could have people get involved with. So thank you.
Great.
And thanks everybody for staying on a little later than we planned, but this is such an important subject, and we wanted to make sure I was so happy to have Poppy come on. And I don't know if anybody got a chance to look up Poppy, but she's amazing. She's famous for, you know, being I was looking up when Cy and I were both looking up things. She became the first female engineer to work in NASA's mission control. And she's also a lawyer, as you can tell, so attorney. So where we were lucky to have her explain a lot of this to us, and we'll be contacting her again and get involved. So thanks for joining us.